Namaste and welcome to the next episode of Clinical Ayurveda. Myself, Dr. Mayuresh Agte. We were discussing Rudrog and we have discussed in detail about the infant condition and how to manipulate this infant condition on the basis of Ayurveda principle, its Vedan Chikitsa, how to choose the dravya and proper kalpana to cure quickly. In that regards, I have told you that many Vaidya in clinical practice always prescribe Arjun freehandly as it is given as a Rudya Dravya. But considering Kashaya Katu Shita Laguruksha, the Rasavirepak of Arjuna, in my opinion, it is totally contraindicated to use such dravya which are astringent, which will reduce the lumen of the blood vessels. In addition, in the case of infant, and it will increase the srotorod to the blood flow because of their constriction action by Kashaya Ras and Ruksha Guna. So, in whenever there is blockage, always don't use Arjun. Then the question remains, if it is contraindicated in the case of infant or any blockages in the blood vessel, what is the exact indication of Arjun if it is Rudya? So let us discuss the indication of Arjun as a Rudya Dravya and in which cardiac conditions it is actually indicated, and it is also very useful also. Now there is another commonly seen cardiac condition in our clinical practice where shape of the heart is increased, that is cardiomegaly, or in other words it is called as boot shaped heart. Now this is a normal heart, for example, and because of some reason the heart becomes elongated and the size of the heart increases, and this boot shaped heart is seen in the X-ray. Now what happens actually in this case, that size of the heart is increased, it means the musculature of the heart or myocardium is now not in a proper stage. In normal heart, if the tone or consistency or sohnan of the muscles is, for example, it is very compact and the muscle fibers are very close to each other, in cardiomegaly the heart size is increased because of there is loosening of the muscle fibers, and because of this loosening there is a shaithilya, mamsa shaithilya in the case of heart muscles, and because of this shaithilya the muscle fibers get separated from each other which were normal at present, and this loosened musculature of the heart in and finally results into the cardiomegaly or boot shaped heart. Now what happens, because first thing, the heart shape is not normal, it is enlarged, muscles are loosed, and these loose muscles also lose the tone also and their strength also. So what happens, that constructive structure is now loosened and muscle fibers also lose the strength, normal strength which they have in the previous life. So their pumping capacity also gets disturbed. So in cardiomegaly, pumping of the heart is affected. You will find LVEF in the echocardiogram that the percentage of left ventricular factor EF is always on the lesser side. As left ventricle factor is affected, the heart blood circulation doesn't reach to the all parts of the body, and then symptoms like edema or breathlessness, all other symptoms start rising. I am not going in detail, just we will talk about the cardiomegaly. So what is happening here, because of looser musculature heart shape is increased, muscle fibers have lost their tone, so their strength is also affected, and this also results in the atrial and mitral valves, because as a looser musculature, because of this, just a minute, because of in normal condition the valves close and open perfectly and they have intact formation. This loosened structure, because of loosened structures, they also this valve get affected and they do not properly get closed and there is gap in between. So when heart pumps, there is always a regurgitation from ventricles to the atriums. So this is another phenomenon appears because of the cardiomegaly. So what is the solution behind that? Shaithilya is under the kapha dosh, and treatment should be the to get the shaithilya and muscles in the proper samvana. So these loosened muscles you have to constrict. In cardiomegaly, musculature is loosened, it is disturbed, and muscles are loosened. So you have to constrict these muscle fibers. So shape of the heart will come to normal, and also this binding of muscle fibers together, as it was previously seen, is also will give tone or samvanan to the musculature of the heart or myocardium. And for this purpose, Kashaya Ras is important. Kashaya Ras, Ruksha Guna, both things. So this Shaithilya will be, which is present there, will be cured by the Kashaya Rasa and Ruksha Guna of Arjun, as Arjun has got Gamitva on the Hruday, and hence Rudya Karma of Arjun, in my opinion, is indicated when there is a cardiomegaly or boot-shaped heart and samvanan of the cardiac muscle is to be achieved. Kashaya Ras makes this Shaithilya Vigata Kapha dosh is cured by the Kashaya Ras and Ruksha Guna. Muscle fibers come together, their constitution is restored, and by that means the samvanan or strength is also restored. So in my opinion, Arjun is Rudya when, or drug of choice, when there is cardiomegaly. Now you can use in any form, in the powder form, aswariष्ठ form. Kshiropat and Ghruta I will not suggest, because Shaithilya itself is a kaphaja prakar of Rudro, because of kapha dosh, sorry. So Ghruta and Shira both are kapha vardhak. So it will be always better to use plain churna or even Arjuna Arishta, Arjuna Arishta form, and hence always remember Arjun Rudya does not mean that it is indicated in any cardiac disease. This or many, this mistake is made by many Vaidyas. Arjun Rudya give in any conditions. Always remember, whenever a drug is acting on any organ, you have to relate the Rasavyapat, Karamkatva of Dravya, and the disease of that particular organ or avastha or samprapti, and just make sure that these Rasavyapat are really helpful on the samprapti of that particular disease of that particular organ. Hope you understood that. Arjun only in cardiomegaly. Thank you very much.